So for the demographics, the patient is a 2.4 years old child, and however, the gender of the child was never disclosed. The patient lives in a rural North Bank Upper River region in Gambia. Gambia is a tropical country in West Africa. So what makes this case very unique is that Hymenopteriasis is not endemic nor pandemic to the rural Gambia. And specifically, the ovoid stage of H. nana or dwarf tapeworm cannot thrive or it cannot survive tropical climate. And Gambia is a tropical country. So actually, this is the first reported case of the disease in the country. So for the patient history, it was generally largely asymptomatic. But however, upon a thorough interview with the mother, it was reported that the child experienced irritable behavior, difficulty in settling down, as well as occasional diarrhea. Anemia and high white blood cells or eosinophilia was also recorded, which are similar na sa symptoms talaga ng hymenopiasis.
So for diagnostic test or assessment methods, we must keep in mind that the tests were done as a part of their screening for the iron supplementation trial. The first test done was their physical examination, and she showed normal vital signs. Next, she had a complete blood count. All other parts of the CBC were normal. However, she had a low hemoglobin count at 10.8, wherein the normal range should be 11.5 to 16.5. Her mean cell volume was 72.7, wherein the normal range should be 75.0 to 100. Her hematocrit was at 32.2%, and the normal range was at 35 to 55 supposedly. Her white blood cells and granulocytes were elevated. Her white blood cells were at 17.8, wherein the normal range should be at 3.5 to 10 only, and her granulocytes was at 12.5, wherein the normal range should be at 1.2 to 8.0 only. And she had a low ferritin count, which was at 12.9 micrograms per liter, which the normal range should be about 30 grams or above 30 grams per liter. They were able to see in her stool test as well the presence of eggs with an intensity of 144 eggs per gram of stool. They were able to identify this as the eggs of the Hymonelepis nina. They were able to her clinical condition was ruled out to be mildly anemic, iron deficient, and presence of granulocytosis with a moderate infection of Hymenopteris nina.
As for the intervention or treatment, a single oral dose of praziquantel in 200 milligrams per kilogram was prescribed to the child, which actually follows the WHO guidelines. And medicine was also prescribed to the family members to prevent further infection. As for the post-intervention treatment, the child was reassessed after 2 weeks and was considered free of the cestode.
For the adverse events during the visits of the child for the praziquantel treatment, the mother reported that the child has been irritable, had diarrhea, and had difficulty settling down, which is said to be symptoms of severe infections of Hymenopteris sana. Other than that, no other events has been stated in the paper.
While it may be rare, if the environment is lacking in proper hygiene and sanitation, or if people from distant locations have recently visited, it is important to consider that even if some parasites are less common in specific geographical locations, the possibility of infection must not be overlooked. Deworming programs may only cover certain parasites and not others, which may cause more problems, especially among pediatric patients. It is essential to distinguish between the different types of parasites in order to prescribe the appropriate medication. Even if physical tests produce normal results, mild infections may initially be asymptomatic. Eliminating the infection as soon as possible is a must to avoid autoinfections, which if left untreated can lead to more intense infections with more severe symptoms.